meta-analyses of both estimated dietary consumption for heart disease. Intake of both omega-3 and omega-6 have been associated with decreased risk of coronary heart disease. Omega-6 fatty acids, based on randomized controlled feeding studies, it is well established that omega-6 fatty acids from plant oils like soybean, safflower, sunflower, corn oils improve lipid and lipoprotein profiles while lowering serum LDL bad cholesterol and apolipoprotein B levels and triglyceride, while also increasing HDL good cholesterol and apolipoprotein A levels, leading to a significant overall reduction in ratio of total to HDL cholesterol and a ratio of apoprotein lipoprotein B to apolipoprotein A1. Intake of omega-6 fatty acid also improves long-term glycemic control, insulin resistance, and insulin production. So, consistent with the beneficial effect on lipids and glycemia, meta-analysis of both estimated dietary consumption or objective measured both blood biomarkers of total omega-6 fatty acids and linoleic acid have been associated with lower risk of coronary heart disease. For example, an individual level pooled analysis from 30 international prospective studies, including nearly 70,000 participants. High blood biomarker levels of linoleic acid were associated with lower risk of total cardiovascular disease and cardiovascular mortality and ischemic stroke. So, based on the lipid and other physiological benefits, meta-analysis of observational cohort studies and older clinical trials, US dietary guidelines and many other guidelines recommend diets rich in omega-6 fatty acids. In a systemic review and meta-analysis of 102 randomized controlled feeding trials, higher intake of monounsaturated fat and polyunsaturated fat improved several markers of glycemia. Specifically, consuming polyunsaturated fat in place of saturated fat reduced fasting glucose, hemoglobin A1C, and insulin resistance, and consuming polyunsaturated fat in place of carbohydrate, saturated fat, or monounsaturated fat also improved insulin secretion capacity. Replacing saturated fat with carbohydrates had no significant effect on fasting glucose or hemoglobin A1C or insulin resistance. And these findings support a beneficial role of monounsaturated fatty acid and especially polyunsaturated fatty acids for glycemic control. In a pooled analysis across 20 cohorts from 10 nations, blood biomarkers levels of linoleic acids were inversely associated with incident diabetes with 35% lower risk per interquartile range. Dietary cholesterol. Dietary cholesterol raises the total serum cholesterol, but it is less important contributor than saturated fat. Eggs are a chief source of dietary cholesterol, but the association between regular egg consumption and risk of coronary heart disease and stroke is uncertain. Take an example. In 2013, a meta-analysis of 8 prospective cohort studies with more than 474,000 participants. There was no association between egg consumption and risk of coronary heart disease or a stroke. I recommend my patients to consume egg every day. Consistent with this evidence, the 2015 Dietary Guidelines Advisory Committee report de-emphasized the previous recommendation to limit consumption of dietary cholesterol to 300 milligram per day, stating that dietary cholesterol is no longer a nutrient of concern for Americans. So go ahead and consume eggs. It's good for you. It's great protein and it does not affect coronary artery disease or stroke. Saturated and trans fats are often referred as the bad fats. They increase your risk of heart disease and other health problems. On the other hand, monounsaturated and polyunsaturated fats are known as good fats and they can support your heart health when consumed in moderation. So here is a quick breakdown of these fats. Saturated fat found in animal products and some plant oils. Trans fat created through industrial processes and found in many processed foods. Monounsaturated fats found in foods like olive oil, avocado, nuts. Polyunsaturated fats that include omega-3 and omega-6 fatty acids found in fatty fish and vegetable oils. So let's see the source of omega-3 source. The source for omega-3 fatty acids: green leafy vegetables, flax and chia seeds, canola, walnut, soybeans, boiling fish, krill oil, and algae oil. Omega 6 source: vegetable oils, safflower oils, meat, poultry, eggs.